Welcome, and today we're unpacking key diabetes topics in plain terms.
We'll cover tests, hormones, genetics, inflammation, obesity, the liver, and the gut.
And if you're 45 or older or care for someone who is, this helps you spot risks early.
Practical, evidence-based ideas, none of the jargon will slow us down. First up, other important tests beyond the usual blood sugar checks. These tests can give a fuller picture of diabetes and risk states.
What's the C-peptide test and why would a doctor order it?
C-peptide shows how much insulin the pancreas actually makes. It helps tell type 1 from type 2.
So low C-peptide means less insulin production?
Exactly. Low suggests beta cell failure, as in type 1 or advanced type 2.
What about autoantibodies? Aren't those immune markers?
Yes, GAD65 and others suggest autoimmune diabetes when positive.
Who should get antibody tests?
Younger adults with sudden insulin need or people with unclear diagnosis.
We hear about A1C. How does fructosamine differ?
Fructosamine reflects average glucose over 2 to 3 weeks, useful when A1C is unreliable.
When is A1C unreliable?
During pregnancy, anemia, recent blood loss, or certain hemoglobin issues. And is genetic testing common in diabetes care? Not routine for type 2, but crucial for monogenic diabetes or unusual family patterns. What clues point to genetic testing? Young age at diagnosis, multiple affected family members, or mild stable diabetes without obesity. How do CGMs fit into diagnosis and management? CGMs reveal glucose patterns day and night, helpful for treatment tuning.
Who should use a CGM?
People on insulin, those with low sugar episodes, and patients needing fine adjustments. Any tests beyond standard cholesterol that matter? Yes, particle size and apolipoproteins can refine cardiovascular risk assessment. Kidney tests, what should viewers know?
Albumin to creatinine ratio and eGFR detect early kidney damage from diabetes.
Do inflammation tests help diagnose diabetes?
Markers like CRP don't diagnose diabetes but show risk and may influence management.
So doctors use a battery of tests to build the whole picture?
Right, A1C, glucose, C-peptide, antibodies, CGM, kidney and lipid tests combine guide care.
Next, hormones and how they control blood sugar.
Diabetes isn't just insulin. Several hormones play key roles.
Start with insulin, a recap?
Insulin helps cells take up glucose and stores excess as fat or glycogen.
What about glucagon?
Glucagon raises blood sugar by signaling the liver to release stored glucose.
I've heard incretins mentioned with newer drugs.
GLP-01 and GIP enhance insulin after meals and slow gastric emptying. They're a treatment target.
Does stress hormone cortisol affect diabetes?
Yes, cortisol raises glucose and can worsen control when chronically high.
Any link with thyroid hormones? Yeah. Thyroid problems can change metabolism and insulin sensitivity. We screen in many patients.
Do estrogen and testosterone matter?
They affect fat distribution and insulin action. Low testosterone in men links to higher diabetes risk.
Yeah. Is growth hormone relevant in adults?
Excess growth hormone raises insulin resistance. Rare, but important to recognize.
How does understanding hormones change treatment?
It guides drug choices, like using GLP-1 agonists when incretin pathways help.
Now genetics, how much does family history matter?
Family history is a strong risk factor, especially for type 2 and monogenic forms.
Type 2 genetic risk. Is type 2 inherited directly? It's complex, and many gene variants raise risk combined with lifestyle factors. What is monogenic diabetes? Diabetes from a single gene mutation, often diagnosed young, and may respond to specific drugs.
Why test genetically if lifestyle plays a big role?
Because some forms change treatment, like sulfonylureas instead of insulin for certain mutations.
Should relatives get tested?
If a monogenic cause is found, relatives may benefit from testing and tailored care.
What about epigenetics? Does environment change gene expression?
Yes, diet, obesity, and early life exposures can switch genes on or off, affecting risk.
Do genetics explain ethnic differences in diabetes rates?
Partly genetic predispositions plus socioeconomic and lifestyle factors drive the differences.
Can genetic info help prevent diabetes?
It can identify high-risk people for aggressive preventive measures early.
Next, inflammation, a key player in insulin resistance.
Chronic low-grade inflammation links obesity to diabetes.
How does inflammation begin in metabolic disease?
Fat tissue secretes inflammatory molecules that interfere with insulin signaling.
Which lab markers indicate inflammation?
CRP, IL-6, and TNF-alpha are commonly studied markers. Inflammation and complications.
Does inflammation increase complications?
Yes, it contributes to vascular disease, nerve damage, and more.
Can reducing inflammation improve diabetes?
Lifestyle changes, weight loss, and some medications lower inflammation and improve control.
Which foods reduce inflammation?
Whole foods, vegetables, omega-3s, and less processed carbs help. And drugs with anti-inflammatory
Any
effects.
diabetes drugs reduce inflammation directly?
Some GLP-1s and SGLT2s show anti-inflammatory and cardiovascular benefits. How does autoimmune diabetes fit with inflammation? Type 1 is an autoimmune inflammatory attack on insulin-producing cells.
Onto obesity and metabolic syndrome central to type 2 diabetes risk.
Metabolic syndrome bundles high blood pressure, high blood sugar, excess waist fat, and abnormal lipids. Why is belly fat especially risky? Visceral fat releases hormones and inflammatory factors that drive insulin resistance.
What are the criteria for metabolic syndrome?
High waist circumference, triglycerides, low HDL, high blood pressure, and high fasting glucose.
How much weight loss helps?
Even 5 to 10% weight loss improves blood sugar, lipids, and blood pressure.
Medications or surgery recommended?
For people who can't lose weight with lifestyle alone, GLP-1 drugs or bariatric surgery may be options.
What practical steps help maintain weight loss?
Sustainable changes, regular activity, protein-focused meals, sleep, and stress management. How do community factors affect obesity risk?
Access to healthy food, safe places to exercise, and socioeconomic elements play big roles.
Next, the liver, a central regulator of glucose. The liver stores and releases glucose and influences insulin sensitivity.
How does the liver manage blood sugar between meals?
It breaks down glycogen and makes new glucose when needed, and that's gluconeogenesis.
Is fatty liver common in diabetes?
Yes, non-alcoholic fatty liver disease is very common and worsens insulin resistance.
What liver tests matter for diabetes?
ALT, AST, and imaging for fatty liver, they help assess liver health. Do diabetes medicines target the liver? Metformin reduces liver glucose production. Other drugs indirectly improve liver fat.
What about alcohol's role?
Alcohol worsens liver disease risk and can complicate glucose control.
How does the liver affect cholesterol and heart risk?
The liver makes and clears lipids, linking liver health to cardiovascular risk.
How can people protect their liver?
Weight loss, reduced sugar and refined carbs, exercise, and treating metabolic syndrome.
When should someone see a hepatologist?
If tests show elevated liver enzymes or imaging shows significant fatty liver.
Finally, the gut microbiome, a surprising influence on metabolism.
Trillions of microbes affect inflammation, digestion, and insulin sensitivity.
Can diet meaningfully change the microbiome? Yes, fiber-rich diets boost beneficial microbes. Processed foods tend to harm diversity. Yes.
Should people take probiotics?
Some strains help, but whole food prebiotics like fiber often have broader benefits. Do antibiotics affect diabetes risk? Frequent antibiotics can disrupt the microbiome and may increase metabolic risk over time.
What about fecal transplants?
Experimental for metabolic disease. Promising in research, but not standard care.
Can microbiome tests personalize diets?
Some companies claim that, and early research suggests individual responses vary widely.
Is there a gut-liver connection?
Yes, microbial products go to the liver and can promote fatty liver and inflammation.
Simple steps to support the gut: eat fiber, diverse plants, fermented foods, limit added sugars, and avoid unnecessary antibiotics.
We've covered tests, hormones, genetics, inflammation, obesity, liver, and gut.
All these pieces interact. Understanding them helps personalize prevention and care.
Can we walk a quick example tying these
Yes,
together?
imagine a 52-year-old South Asian woman with belly weight, rising A1C, and fatty liver. Multiple drivers are at work. What test would you order for that person? A1C, fasting glucose, lipid panel, liver enzymes, ACR, and maybe C-peptide or CGM as needed. And hormone checks? Screen thyroid, consider cortisol if stressed, and assess sex hormones if symptoms suggest.
When to worry about genetics in this example?
If family members had early diabetes or lean diabetes, consider genetic testing. How would inflammation be addressed? Target weight loss, anti-inflammatory diet, and manage comorbidities to reduce chronic inflammation.
How does this shape treatment choices?
GLP-1s could help weight and inflammation, metformin to reduce liver glucose production.
Core lifestyle advice for viewers?
Move more, prioritize sleep, eat whole foods with fiber, limit refined carbs, and stop smoking.
How often should people 45 plus be screened?
At least every 3 years for average risk, more often with risk factors or abnormal tests.
Which specialists might help?
Endocrinologists, dietitians, hepatologists, and sometimes genetic counselors.
A one-line summary of medication classes: metformin, GLP-1 agonists, SGLT2 inhibitors, insulin, each targets different pathways.
How should patients monitor at home?
Follow A1C schedule, consider home glucose checks or CGM if advised, and track symptoms.
How important is social support? Yeah.
Crucial support from family, community programs, and health coaches improves outcomes.
Any myths to bust quickly?
Myth: diabetes is just about sugar. Reality: it's metabolic and involves many organs and hormones.
For prevention, one key takeaway:
Sustained lifestyle changes are the most powerful prevention tool.
For prevention, one key takeaway:
Sustained lifestyle changes are the most powerful prevention tool.
Red flags that need urgent attention?
Very high glucose, severe dehydration, confusion, or signs of infection pipe, seek immediate care.
Where can viewers learn more?
Trusted sources: primary care providers, diabetes educators, ADA and international guidelines.
Any advice tailored to American and Indian audiences?
Adapt diet advice to local foods, consider cultural meal patterns, and use community resources.
What about cost concerns for tests and drugs?
Ask providers about lower cost alternatives, patient assistance programs, and community clinics. Are apps and devices helpful? Yes, sir. CGM apps, activity trackers, and nutrition apps can support self-management.
Don't forget mental health. How does it tie in?
Depression and stress worsen diabetes outcomes. Mental health care is part of treatment.
Quick summary of the essentials?
Use appropriate tests, address hormones and inflammation, treat obesity and liver health, and support the gut altogether.
One simple action for viewers today?
Ask your doctor for an A1C and discuss waist measurement and liver screening if you have risk factors.
Quick summary of the essentials?
Use appropriate tests, address hormones and inflammation, treat obesity and liver health, and support the gut altogether.
One simple action for viewers today?
Ask your doctor for an A1C and discuss waist measurement and liver screening if you have risk factors.
We'll answer common viewer questions next episode.
Send your questions and we'll pick the most asked and expert answer them.
If this helped, please subscribe.
Hit the bell so you don't miss weekly health updates.
Share this with family who might benefit.
Early awareness can change outcomes for people you care about.
Next week, we'll dive into managing diabetes during travel and festivals.
Practical tips for medications, meals, and glucose monitoring on the go.
We base advice on current guidelines and clinical evidence.
But this video is informational, and talk to your healthcare team for personal care. Tell us your experience. What tests or changes helped you?
We read comments and may include them in future episodes.
Follow us on social for quick tips during the week.
Links are in the description. Join the community.
Want to reduce diabetes risk? Start with one habit this week.
Pick one. Walk 20 minutes a day, swap sugary drinks, or add one more vegetable.